Hello, everyone. My name is Gary Baumgarten, but I expect you already know that. And I welcome you to this discussion on Facebook Live, paltalk.com, and on YouTube. You know, this thing has been dragging on, this pandemic. It's bugging us all. Some of us are stuck in our homes. Some of us are going out. Some of us are going to work, but we're not socializing the way we used to. But for the people who are in our nursing homes, it is beyond what we're going through because we know that when we have a loved one in a nursing home, if we're very good relatives, if we're good sons and daughters, grandsons and granddaughters, we go and visit grandma and grandpa, mom and dad. We visit them on a regular basis because yes, there's a staff, yes, there are other patients to interact with, but there's nothing like that personal contact, that personal touch even between a relative and a loved one in a nursing home. Otherwise, it's just a lonely, lonely, lonely existence. Well, now, virtually every nursing home, assisted living patient or resident in our nation is suffering through because of the pandemic. We're not allowed to go and visit them. They're suffering through loneliness, and it's horrible. Who's advocating for the patients? Who's advocating for the family members? Well, I'll tell you who's advocating. My guest, Robyn Grant, is advocating. She is with a group called the consumervoice.org. Robyn Grant, welcome to this discussion on Facebook Live, paltalk.com, and on YouTube.
I'm just delighted to be here, Gary, and to talk about this issue, which is just, as you said, having just a tremendous impact on nursing home residents and assisted living residents.
I'm hearing from people who work in nursing homes. I'm hearing from family members who have relatives in nursing homes, Robyn Grant, that their loved ones are so depressed that some of them are getting dementia or signs of dementia that they didn't even exhibit before the pandemic broke out.
That's right. We're hearing that from all around the country. Individuals who didn't have dementia, I mean, they have lost their foundation. They have lost the people in their lives that ground them, that connect them back to family and to the community, and that's incredibly disorienting and devastating. So many are getting confused. They're losing their cognitive abilities. We're hearing that those who already had dementia are getting much worse. They're becoming agitated. They feel like they've been abandoned. They don't understand, that what's going on. And to them, it feels like, what's happened? My family doesn't love me anymore. They have turned their backs on me, and this feeling of loneliness is leading to, even if you don't have dementia, despondence. Depression, anxiety, really deep despair. It's just making residents feel there's a deep sadness, and we're hearing this just from residents themselves who are telling us just how very difficult it is. They have nobody. I mean, they for the most part, residents are confined to their rooms. So they have staff, coming in, but that's the extent of it. We've even heard of some places where the facility has closed the curtains and closed the doors, so residents can't even look out and see another human being in the hall. So it's just tremendously isolating. That before all this, I mean, residents would be able to go to the dining room and have lunch and have meals with others. There were activities. All of that has been shut down, so they are by themselves, maybe with a roommate, alone in their rooms.
Well, as you know, my friend Elliot Gordon, who you've made his acquaintance, I've actually gone with him several times when he's gone into nursing homes to perform for the residents there. And uh, I talked to the activities director at one of the nursing homes, and she pointed out a patient to me who was holding her walker and dancing and singing along. And she says, you know, this lady has been non-communicative. It wasn't until Elliot came in and she looks forward to him every time, and they all do. They look forward to him, and I'm sure other in-house entertainment that they could offer. Well, now for over 4 months, there's been none of that. Zero, zip, nada.
There it certainly hasn't been anything outside of a residence room. Some facilities have brought activities in, so maybe one-on-one activities, or they have found ways, if they're able to broadcast something throughout the facility, they may do some group activities that way. But again, you know, you're by yourself. I know a number of homes are trying to do what they can, but there ultimately is nothing like actually being with another human being. And that's taking a real, having a devastating effect now on residents. There's been an effort to do televisitation, so to communicate obviously through the phone or through Skype and FaceTime, and the federal government has made some money available for places to buy tablets and that kind of thing to make that more happen more often, and that can help. But there are some residents for whom that just doesn't work. I mean, you have a resident with brain injury, a resident with dementia, something that they don't know what's happening, and who it can be scary even, you know, who's that talking to me? Where's that voice coming from? And it requires a lot of coordination on the part of staff. For most residents, they need assistance from staff to help them with the technology. Not all residents, but many. And so that means it has to be coordinated, it has to be set up. You need staff assistance. It doesn't just happen. So that means that it doesn't happen as frequently as, you know, people have been having that contact before. Certainly not for the most part daily. So it's no substitute.
From some caregivers, Robyn Grant from the, I always glance down to make sure I get it right here, the consumervoice.org. I hear from many, not many, but from several caregivers who work in nursing homes that they have patients who are exhibiting such depression that they're fearful that they're actually suicidal. Now, they may not have the means or the physical ability to end their lives, and that, I guess, is a good thing. But the fact that they even would be expressing such despondency shows where their head is at, and that's horrible.
It absolutely is. And again, we're hearing that from families and residents, and from folks that are called long-term care ombudsmen, who are advocates for nursing home residents. And this depression is leading to withdrawal. It's leading to residents feeling like, what's the point? It's going to just be this, I'm not going to be able to see my family for day after day after day. And there's a real sense of giving up. So we're hearing about residents who are saying, why should I get out of bed in the morning? Why should I go on? So they may not be killing, and we certainly hope they won't find ways to kill themselves, but they are fading. They are losing their will to live. And when you give up that way, the body starts shutting down. And so we certainly have family members who've told us they believe that their loved ones died of basically of a broken heart.
So we understand, I think even you do as an advocate, the reason why these restrictions were put into place. The coronavirus is a very insidious one, and there's no vaccine, there's no cure yet. Hopefully science will help resolve that in the very near future. But That being said, there has to be a way, I think, to have some kind of a balance here. As in all of life, we have to adjust. There has to be some kind of a balance. I mean, we have to go out and buy our food. Some of us have to go to work. So we take those risks. There's a balance to all of this. We have to be prudent, but we can't be locked up inside completely. The descriptions that I am seeing of many of these facilities is that they're more like penal institutions than they are nursing homes. You can't go and visit. They can't go out. They can't go and walk around the grounds, even unless they're in solitary confinement or on death row. An inmate in a penitentiary can at least walk around the grounds of the prison. So this may even be worse than being in a prison. So how do we balance the need to protect the staff and the nursing home patients from the coronavirus and also give them some sense of quality of life?
Yeah, that is exactly the issue, and I think that's what we have to find is that balance. And when the virus first started sweeping through nursing homes, that was about in March. The federal government issued the guidance that basically shut facilities down from visits. We didn't know that much about the virus, and so extreme measures were absolutely, in our opinion, called for. But as time has gone by, and we understand more about the virus and how it's transmitted. And also, we're seeing the impact. 5 months ago, we didn't know what the impact is, but now we are seeing residents who are being harmed by this. And so we have to take the fact that the measures that we're putting in place to try to save a resident are actually in many respects harming them. So the trick is to find a way to keep infection control prevention measures going, but still allow residents to have contact with their loved ones. And so we believe that we are advocating with the federal government to ease the restrictions, to begin to expand the opportunities for connection more. We're not saying, and this is trying to balance, we're not saying throw open the doors and just let's go back to where it was. Absolutely not. But we believe that there needs to be a phased-in approach, kind of a measured, cautious approach where you move toward full and open visitation, and that we need to start by helping have families come in and provide that emotional support and sometimes even physical support, because a lot of families provide actual physical care in terms of help with eating and help with making sure residents get enough to drink, by letting those people in to provide really life-sustaining support to residents. We have residents who have declined so much that they are physically ill, and as well as being psychologically distressed. And so we feel like you start with providing help and visits for those folks who are seriously have been harmed and are at risk. And then we expanded to perhaps having every resident be able to have one designated visitor. We are really advocating at the same time for testing. We need rapid response testing so that family members can say, I've been tested and I'm COVID negative. Maybe they need to be tested on a regular basis. So we have a comfort level that when they come in, they're COVID free. And so we hope that will, with advocacy, that we can get to that point just as quickly as possible, because that will make a huge difference. But we're really pushing for these policies to be lifted in a sensible, safe way.
So you do that kind of advocacy at the consumer voice. And one of the things that I find perhaps most distressing it's a very difficult decision that one must make on whether or not to put a loved one in a nursing home. Uh, Sometimes it's just totally unavoidable. Sometimes it's a matter of convenience. I know from the people who I know who have had to make that decision, it splits families apart. People question after they make the decision, did they do the right thing, and so forth. So, not to be critical of people who have decided or been forced to put a loved one in a nursing home. Perhaps I, as a child of a parent who I've placed in a nursing home, feel because of the COVID, because in some states, including New York, they were actually putting COVID positive people into the nursing home environment, which is a subject that we're going to be discussing on Monday, which I find absolutely disgusting. Um, Maybe I want to take my loved one home and care for him or her at home, at least for the duration of the pandemic. But I'm hearing stories that people are being denied the right to bring their own loved ones back home. How can I be prevented from doing that?
Well, you actually can't. I don't know what the situation is there, but a resident has the right to leave the facility, and family members, if that's what the resident wants to do, the family member absolutely has the right to take the resident home. We do think that it's not an easy decision to make. And there are a lot of factors to consider, because chances are very likely that your loved one has been placed there for a reason, because perhaps you can't provide that care at home, or you can't provide the 24-hour care. So you have to really think through, can you provide that? And if you need outside help, can you get it? And will there be enough staff, and will they be COVID free? I just want to share that I had to go through that decision back in January to place my father in the nursing home. And that was because it was the only place where he could get the supervision round the clock that he needed. And no, he was there for 3 weeks, I believe, no, 6 weeks, and then COVID hit. And so I too experienced what it was like to not be able to visit him. And he did not understand why I couldn't. And so the agony of knowing, that you can't be there just was, it was devastating. And we tried to do FaceTime, and it had to, could only happen when there was when there was an aide there who could actually make it work. And still, it obviously wasn't the same. And so I feel for families, and I feel for the residents, because I see how it affected my father, and ultimately he did lose the will to live, and the cause of death is failure to thrive.
Yeah, I'm so sorry to hear that, and
It is very,
it's horrible.
very real.
So for you, it's not just a job; it's a reality, and I appreciate you sharing that. I know it was difficult for you to do it. I think, Robyn Grant, that it's very important to have these kinds of discussions. I don't think this is being discussed enough. I think we get too much in the weeds with other things going on in our society today, even with the coronavirus, with the election, with the protests. We're very divided. This is something where I believe, I hope, and by the way, I just did a podcast today about this very division around the coronavirus. It's available on my timeline on Facebook, and also it's called the Gary Baumgarten Report. You can find it on most podcast platforms. But that being said, perhaps this is an area where people agree with you and me. We would be very hard pressed to find, I think, in society, people who disagree with what Robyn Grant is saying, what Gary Baumgarten is saying, that we have to find some kind of a consensus, some kind of a middle ground, some kind of a compromise. There was just a study recently from a university in London that found that, you may be protecting people in nursing homes from the coronavirus by isolating them, but you're increasing the risk of tuberculosis.
Oh
So,
my.
so there's, there's unintended consequences. I don't think that anybody who came up with these regulations, whether they're on the federal level or the state level or on the local level, wanted to make things worse for the people in the nursing homes. I'm not accusing them of being bad.
No, absolutely not.
But I think there are unintended consequences. And now,
Now we know what those
then,
consequences are. Yeah.
right. And remember, back then we were thinking maybe by summer when it gets warm out, this would be gone.
Right.
Maybe by September, this would be gone. Well, now they're talking maybe by next July, maybe not.
Residents cannot sustain that.
So if in fact this is extending, and it already has extended, we have to reevaluate our initial decisions with regard to our elderly people. We are too dismissive of the elderly anyway in our society. This is something I hope you get the opportunity to have your words heard by all of my competitors. I want your voice to be amplified.
Thank you so much. I just want to say we are hoping there will be a groundswell to find this middle ground. So we're asking people to share their stories with us because we can take those stories and use them in our advocacy. So I'm going to do a little plug here for our website, which is www.theconsumervoice.org. And if you go there, you can be directed to a page about just on COVID. Tell your story so that we can tell your story and use that to try to come up and develop, sensible policies that keep residents safe, but keep them alive.
Well, I will be posting that below here on Facebook and on YouTube. And I know that Alan right now is posting it to Pal Talk. Alan, it's www.theconsumervoice.org.
That's right.
Robyn Grant, thank you for taking the time to tell us about all of this. The audience doesn't know this, but because of a power loss, I nearly didn't have a guest today, and you came riding to the rescue at the last second. I appreciate that.
Happy to do so. Happy to have the opportunity, and thank you so much for focusing on this incredibly important issue.
Totally my pleasure. Everybody, please stay safe, and as I like to say at the end of our get-togethers, peace out.